moving across the island. And this will bring even more rains. And the forecast is that we will have afternoon rainfall tomorrow and Friday, with an increase in showers and thunderstorms expected for the weekend. I urge all Jamaicans to exercise great caution when traversing our roads and pay attention to the alerts and warnings from the authorities. Now, especially during this period of the pandemic, we must emphasize that we have to be very strategic in how we allocate and use scarce resources, both to be administered in the management of the pandemic and also in the management of these very disruptive and oftentimes very destructive weather events. So part of being strategic means that we have to give priorities. We have to make priorities. And the way in which we will therefore expend the resources will be directed by the imperatives of getting our economy back on track, improving our productivity, and of course, dealing with those persons who have suffered real damage and are in real need, and dealing with the most vulnerable in our society. So that has been the general direction that has been given to the NWA for the resources that will be allocated to ensure that we are able to quickly recover from any dislocation from these rains, and as well ensure that persons who are vulnerable, who have been affected, that there is some outreach. You would have heard me in Parliament announce as well that we have given an allocation to constituencies, 1.5 million Jamaican dollars, to be used to assist the most vulnerable in each constituency for housing repairs. $1.5 million, not a lot of money. And I know MPs, they know how to make it stretch, but there is always a breaking point. We will be scouring the budget to see what additional funds we can find to supplement that amount, but I urge the Jamaican people to be reasonable and to be patient. We are going through a difficult time. We have had to be making greater allocations for the COVID pandemic and now with these shocks. But we're going to do our best to ensure that no Jamaican is left behind and that we are able to respond as best as we can. We're also giving each constituency an allocation of $1.5 million, and that will be used, we call that a rehabilitation grant, and that is to help our shopkeepers, our restaurants and bars and small businesses who have been affected by the rains to restock. And again, it's not a lot of money, and I'm encouraging the members of Parliament to use it to target the most vulnerable and the most affected in the constituency by this weather event. Again, we will be scouring the budget to see what other reallocations can be done. There will be no new allocation within the budget. We are going to stay within the fiscal limits set, and it really means that our MPs, our ministers, have to make greater decisions on what are actually priorities. And as we do that, we should be able to find the additional resources, but we're also at the same time making decisions as to what we cannot pursue this financial year and what we will have to put off for the next financial year. But more than that, it is also forcing us to be far more efficient and considered in our expenditure decisions. So, the members of Parliament and the ministers, they're all lobbying for more money. But we are going to maintain our fiscal discipline, and councillors, of course. But we're going to maintain our fiscal discipline, and whatever additional funds have to be found for the emergency response, it will come from the existing budget based upon reallocation and reprioritization of needs. Having dealt with that, let me now turn to the pandemic issues. And as usual, I'll start with our graph. And hopefully you should be seeing the graph now displayed. The solid black line, which is now appearing, shows the cumulative number of cases. 8,787 cases. Unfortunately, since our first case, we have had 196 deaths, as depicted by the red line, which should now be appearing. Once again, I pause to offer my sincere condolences to all who have lost loved ones. Sometimes when we make note of this, it can appear as if I'm just giving a statistic, and we lose sight of the fact that we're talking about lives, people who have lost families, loved ones, friends, people who were contributing to our economy and our society. And they have succumbed as a result of being infected by this very deadly virus. We're talking about people and lives, and so we pay the greatest of respect to that when we point out these numbers. The green line, which you are now seeing, signifies the number of persons recovered, and we are now at 4,347, and that's a 49.5% recovery rate. And the final line in this graph, which is the blue line, which should now be appearing, shows that we have 4,126 active cases. And that is the number of persons who still have the virus or who are still infected. And after the spike in August and September, the number of active cases is now showing a sign that it is flattening. And at points, maybe you could even say that you are seeing a declining trend. Indeed, the recovery rate has now overtaken the active rate, which is a good sign. Still too early to say that we are out of danger's way, but I believe what we are seeing here is that the measures that we have put in place, that they are working to arrest the exponential increase that we were previously experiencing. After the spike in August and September, our growth in new cases has been slowing down and our recovery is increasing, which has resulted in the number of active cases showing moderate and modest decline. To further control the spike, the current measures, which were to expire on October 31st, are now being extended. The island-wide curfew will remain at 9 p.m. to 5 a.m. daily until November 16, 2020. As it relates to the provision of public transportation, the provision of public transportation by motor car being limited to one person, less than the maximum number of persons allowed to be carried under the relevant license, will remain in effect until November 16, 2020. As currently obtains, public transportation operators will be allowed 1 hour before and 1 hour after the curfew to get to and from base or home. We should note that passengers are not allowed during this 1 hour before and 1 hour after curfew hours. We are paying very close attention to the concerns being raised by the quick service industry and the restaurant and beverage industry that they are not able to service demand. People who are going home from work would want to be able to get food to take home. And we are examining certain measures that could be put in place during the curfew hours that would allow for the delivery of food during that period of time. We have not yet finalized those measures. So at the next iteration of these measures, we should be able to have in place measures that would see fast food outlets and other food outlets being able to provide food service during the curfew hours for a defined period. And that is now being contemplated, and we believe that once we have finalized that would assist the industry in recovering even more. Now, the ban on funeral services and parties and other such events will continue until November 30, 2020. Burials will continue to be allowed, the restriction of 15 persons. Now, regular worship services operating in compliance with the established protocols will continue. Congregants are reminded that gatherings in excess of 15 persons are not allowed outside the place of worship. Now, the restrictions applicable to hospitals, nursing homes, and infirmaries remain in place until November 30th, 2020. The age limit for the stay-at-home measure remains at 65 until November 30th, 2020. Persons 65 years and older must therefore continue to stay at home, but will be allowed to leave home once each day for the necessaries of life. Now, given the high vulnerability of persons in this age group, particularly those with comorbidities, I cannot overemphasize the importance of strict adherence. Most of our deaths are of persons in this age cohort. Now, the current protocols under the controlled re-entry program for both residents and visitors remain until November 16, 2020, while the requirements for pre-testing and quarantine remain the same. We are implementing various operational improvements to streamline the processing of arriving passengers at our airports. We continue to encourage all businesses to facilitate their workers working from home if they are able to do so. Now, in addition to these island-wide measures, we have been implementing special curfew measures in certain areas that are densely populated with a potential for exponential rise in cases. These are currently in place for the Raytown community in Kingston and Cornwall courts in St. James, and these will be in place until November 6, 2020. In these areas, persons are allowed to go to work, take public transport, carry out their essential activities of daily living, such as shopping or visiting the doctor or carrying out their small businesses. However, the following additional restrictions would apply. One, the curfew is from 6 p.m. to 5 a.m., and during the curfew hours, only essential workers with identification are allowed to enter and exit the defined curfewed area. The gathering limits in these areas are much stricter. No more than 6 persons are allowed to gather in any public place. And 3, all the other existing restrictions, such as mask wearing and physical distancing, are strictly enforced. Now, I know that a number of persons are suffering from COVID fatigue, and that is now a real phenomenon, Minister Tufton. Living under these restrictive measures for now more than 6 months, it is having a real psychological impact, and the government recognizes this, and hence the Ministry of Health is putting in place a strategy to deal with the mental health dimension of the pandemic. And Minister Tufton, when you come to speak, you may want to say a few words on that. And I take the opportunity to say to the Jamaican people that we understand that, and we're seeing it being displayed in all kinds of ways. We're seeing it being displayed in a resistance to law enforcement when they are enforcing the measures. And let me just say here that that is no excuse for disobeying the law, for disrespecting our law enforcement officers. And there will be no let up by the security forces because someone may claim that they are just fatigued and tired of the situation. There is no excuse. And in fact, what we have said to the security forces is that they must maintain the orders under the Disaster Risk Management Act and increase their enforcement. There are other ways of dealing with the stress, of coping with the stress of these restrictions and managing the pandemic. We will never countenance as a government any action that results in the breaking of the law, threatening the lives of our law enforcement and first responders. I also want to thank our business people who have been generally very understanding and very supportive of the measures that we have had in place. We are aware that it is taking a toll, a significant toll on the economic livelihood of our private sector and our business entities. Today, I had a meeting with our 3 main contract carriage operators within the tourism industry, Juta, JCAL, and Maxi. I'm very impressed with them and their patience, their innovativeness and creativity in weathering the storm. Like all other business operations, they have come to explain their situation to the government, and we receive them and listen to them very carefully, and we will see what is possible to assist. What they have placed on the table with us is no different from what other businesses are going through. They point out as well that they are playing their part, like many other businesses in Jamaica, playing their part to support. In the first phase of the pandemic, they volunteered some of their buses to carry nurses to and from work. And I believe Minister Tufton, PS in health, that might still be going on. In fact, I gather it's still going on. They're still helping. So even in the midst of this crisis where people are losing and facing difficult times, as a nation, we have these very good stories of people showing a great level of social responsibility and corporate responsibility in playing their part in ensuring that as a nation we can get through and pull through this pandemic. I'm going to ask the Minister of Health to make his report, and then after that we have the Minister of Education here who will be giving us an outline as to the way forward for face-to-face education. For some, this will be good news. For others, it might be a source of concern. But I believe that what you will present to us later on, Minister, that it will be a very comprehensive and well thought out strategy. And then, of course, I have the Minister of Local Government who will give us an update on the measures that we have put in place for the infirmaries. Minister Tufton.
Thank you you very much, Prime Minister. Firstly, I'd like to remind the public that the Ministry continues to upload the daily information on COVID on our website at 10 a.m. each day for the previous day, and we certainly would encourage our viewers and the public generally to get the updates placed on the website each day. The Prime Minister would have outlined in his graph the trends as it relates to new cases or active cases and the encouraging sign of it giving an indication of flattening out. As he said earlier, it's not an indication to be complacent. In public health, the team has been monitoring and discussing the encouraging signs of less cases each day, with positivity rates now moving down from over 30% at its highest points to today, I think it was 14%. The day before yesterday, it was 8%. And this is all very good. Having said that, it's an indication of the measures that we're taking, and so we certainly encourage the public to continue to abide by those measures until we get to a point where we think we are confirming the downward trend. So that's encouraging, and we want to commend the team on the ground and the public for supporting those measures. The Prime Minister also indicated that there are side effects to the COVID measures, and it is something that the public health team are very seized of. The fact is, fatigue has set in, not only for the public because of the measures, the restrictive measures, which essentially has changed their lifestyle, and changed their lifestyle in a very radical way, where they now have curfew times. For the senior citizens, they have to stay indoors, and it is having an impact. And the studies that we have done, the tracking or tracing that the medical team on the ground have done, is confirming that there are segments of the population that are more affected than others, but there's definitely fatigue that exists in the general population. As a result, we have launched a number of programs to try and address that fatigue. From the frontline staff perspective, we have had a wellness program, and we have given details of that, which essentially is an attempt to give frontline workers, not just healthcare workers, but frontline workers in the COVID response, an opportunity for rest and relaxation, for counseling, for priority testing, and the details of that have been made public, and we will continue to work on that. The response has been positive, but I want to use the opportunity on behalf of the public to thank our frontline workers for the work that they have done, because they have definitely been the heroes of this effort. Beyond that, as it relates to the general populace, the issue of mental stress and their mental health generally is a side effect of the COVID response. And in a strange way, the more you abide by the restrictions that are announced, is the more you're likely to be a victim of that side effect or those side effects. It's a challenge, because it's not an excuse not to abide by the measures. Instead, what we have to do is to promote coping mechanisms to deal with those side effects. And it's not unique to Jamaica, by the way. It's now one of the topical global issues that's affecting countries or citizens throughout the world. So the mental health response to COVID, we started over the past week and a half. We've had Zoom meetings with over 500 leaders, community leaders across the country in every parish. And we're talking about from the Custos to the JPs, to the Citizens Association presidents, to the youth club groups. And we are recruiting almost an army of individuals who are willing to volunteer, who are leaders anyway in their own right, in their respective institutions. And we're doing an online training in conjunction with PAHO, WHO, around coping mechanisms along mental health to deal with the side effects related to COVID, the fatigue related to COVID. That process is very encouraging in that a number of persons have come forward to support this initiative. And the coping mechanisms range from just listening to someone who is lonely and have them have someone to speak with, to helping them to buy their groceries. Someone who is a senior citizen who is afraid of going out. So it is as basic as that, but can be elevated to understanding where persons are experiencing mental stress and require professional support. And at that stage, we elevate the conversation to the public health team who are trained to offer that kind of service. So it really is expanding the base of support at the community level, using ordinary citizens who want to help, training them in the basic mechanisms of just assessing, listening, reaching out, based on their knowledge of the community and persons in the community who may be affected, and then doing so under the supervision of the public health team, whether it's the community health aides, the mental health nurses, the public health nurses, and referring where additional support is needed. So that is going to happen as a key component of the response in the weeks and months ahead. In addition to that, we have been reaching out to young people, Prime Minister, because there is a sense that because the statistics suggest that persons who are young without underlying conditions may get the virus and not even know that they are safe, and by extension they represent no threat in the general populace. And it's very easy for that segment of the population to become complacent and comfortable. The reality is that they go home and they take it to their grandmothers and their mothers and their aunts. And we have had cases, Prime Minister, where a adult, infected a mother and the mother died. So it is a real threat, and the consequences of that, therefore, is that the message must extend to all of us, and young persons must understand, or the youth in the society, the younger persons, that while they may not be as directly threatened, they could represent a threat to those they come in contact with. So we have started a program around that, which is a youth response, to get them to understand and to use them where they are willing as part of the response. Beyond that, Prime Minister, as you said, 64 new cases, 198 deaths over the last 24 hours, only 2 deaths, and we express our condolences to those who have died and their families. But our active cases are now on the decline, and certainly less than the cases, our recovered cases are more than our active cases. My final update is as it relates to the Golden Age home, which has been our topical issue in terms of vulnerable communities. Further to the announcement of the cluster of cases at the Golden Age home, the Kingston and St. Andrew Health Department has completed testing of all residents. These are the final numbers after validation and consultation with the home, and we have worked very closely with Minister Mackenzie, of course, who is the Minister of Local Government and Rural Development. Of the 620 residents and staff members tested over the 3-day period, 87 results have returned positive for COVID-19, while 553 were negative. The 87 positive cases include 65 residents and 22 staff members. All the positive cases remain stable, and that's good, and asymptomatic, except for the first case, who unfortunately has since died. The deceased is a 73-year-old male whose death was noted in the COVID-19 update for last evening, so he's now included in the numbers that were announced. In the meantime, a meeting was held with the management team and cleaning service provider to outline the corrective measures to be taken at the facility. Training of staff members and the service provider commenced on Monday, October 26, 2020, and the daily visit by the medical officers will continue as the health team ensures that the positive cases are isolated appropriately and that they are monitored closely. So we will continue to do work at the Golden Age Home. It's the largest such facility in the Caribbean, and there's need to ensure that the protocols are observed. But I think we're out of the woods in terms of the risk and the threat to the residents and the staff there. And I want to commend the KSA team, the health department, the local government and others, because I think we moved in very quickly to cauterize the situation. And that's going to be a feature of the community transmission. We conduct surveillance across the country, and where there's a need to move in, we move in and quickly try to manage that situation and bring it under control. As it relates to other similar facilities, I know the questions have been asked. Our latest report on inspections of residential facilities reveal 236 such facilities have been inspected, including 203 nursing homes, 13 infirmaries, 14 children's homes, and 6 rehabilitation institutions. Some 99 nursing homes, or 48.8%, were found to be compliant with the COVID-19 protocols. The same obtained for 7 of the infirmaries, 4 children's homes, and 2 of the rehabilitation institutions. 2 nursing homes, one in Manchester and one in Hanover, upon inspection were ordered closed, and the others have been served notices under the nuanced regulations and given up to a maximum of 30 days to become compliant. And the team will be out in the field to inspect and to visit, if necessary, every day until those facilities are brought into the appropriate protocols. As it relates to prisons and lockups, 43 of the 106 in the country have been inspected so far, with 12 meeting the COVID-19 standard, while the other 31 have been given a timeline within which to become compliant. The Ministry of Health and Wellness continues its work with the Ministry of Local Government and Rural Development, the Ministry of National Security, and other ministries, agencies, and departments, where applicable, the NGO community, to ensure the COVID-19 protocols continue to be observed and that all the infection prevention and control measures are in place. Thank you very much.
Very important that we understand that we're not just doing these things for show. These infection prevention and control measures are well thought out and well established in public health science as to the control of the virus. And what we wouldn't want people to feel is that we just do this for show. This is how we are living with the virus. And it's very important that everyone, in carrying through these measures, faithfully carries them through to completion and in the full way. A few weeks ago, I met with the principals of schools in my constituency. Just this evening, the Minister of Health told me that he met with his principals. And the sense that I got from my principals was that they wanted to have the children back in their school. Yes, they had fears, but you know, a true teacher, someone who is committed to their profession, who considers it more than a job, but a calling, it pains their hearts to see the children running up and down in the community, probably at similar or higher risk of infection, under no supervision many times, when they could easily be in the classroom. Now, this is a simplistic way of putting the problem, and this is a simple narrative of the problem. The problem is indeed more complex, because within the population of teachers, like the general population of our society, we have a high level of NCDs, non-communicable diseases. which form the basis of the comorbidities, which make contraction of the disease so dangerous. So it is not merely an issue of saying, well, we should bring back the children in school. In doing so, we have to also ensure that we ensure teachers are safe, that those who do have comorbidities, that they can participate in the process without necessarily being physically present. And for communities where we have identified that the transmission is low or non-existent, that we could figure out how they could move. And so based upon that and other calls that we have received, and a sobering understanding that the pandemic has not just had a devastating health and economic effect, but it is threatening to also have a devastating educational, a devastating impact on our education system. Because already we had an unequal system, and what is going to happen now, 6 months or so out of school, is that the problem could be exacerbated. And then, yes, you know, kids had this system because, you know, economics and their socioeconomic background, many of them were not able to access the best education. Now, moving them from the physical delivery to a virtual platform, again, you see the inequalities. There are some children who have tablets and computers and internet at home, and those schools report 95% attendance at virtual classes, and it is as if they have not missed a beat. But then there are others, the vast majority actually, of schools reporting less than 50% attendance at the virtual classes. Situations where, you know, which I've seen firsthand and brought to my attention firsthand, the family only has, you know, one device, and that has to be shared amongst all children. Teachers only have one device, and they have to decide whether or not they're going to use it to teach or give it to their child to learn. And the government can't overnight solve this digital divide problem, even with the generous allocations that we're making towards the provision of tablets and computers. What I have done, you know, I've dedicated resources for my constituency and personally to acquire devices, and these devices are not inexpensive. But you begin to see the magnitude of the problem that, you know, from our resources, we may, you know, a member of parliament may be able to buy 200 devices, but they may have over 2,000 children. Who do we decide to give? We have to therefore move very quickly to a solution where we can safely return children to the classroom. And it is not something that we are proposing to do overnight, but to do it in a strategic, well thought out way which protects both the teacher and the children and the parents, and at the same time prevent any exponential spike in our numbers. So I'm going to invite Minister Williams to come and give us an update as to the way forward. Minister Williams.
Thank you, Prime Minister. Colleague ministers, Minister Morgan, PSAs, Chief Education Officer, media, distinguished ladies and gentlemen, Jamaicans all, good afternoon. For this press conference this afternoon, I would like to lay out for parents, teachers, principals, stakeholders, in fact, all Jamaicans, our thinking on how we would like to engage our students again in the face-to-face modality. The face-to-face will be in addition to the other 3 modalities or approaches that schools have been using since October 5, when schools were declared open for the teaching and learning experience. As you're aware, The current three approaches are the online approach, in which students and teachers meet in the virtual classroom, the audiovisual approach, in which lessons are being broadcast on TV, cable networks, and various radio stations, and the learning kit approach, in which students who don't have access to the online world, TV, cable, or radio station, use their hard copy textbooks and worksheets, and together with their teachers, lessons get completed, and together there is interaction with the student and the teacher. Over the past 3 weeks, since October 5th, we've seen greater and greater adoption of these approaches, despite the many challenges. Some 20,000 teachers stepped up and were trained to create virtual classrooms, upload material, and engage the students in the online world. Over the 3 weeks, we saw as well more students embrace the various approaches, with more students utilizing the online approach. Roughly 14,000 of our teachers taught from their homes, while about 4,000 taught from schools, and we know that there is learning that's taking place. By using technology, both teachers and students are developing skills essential for the 21st century. Modern learning is about collaborating with others, solving complex problems, critical thinking, developing different forms of communication and leadership skills, and improving motivation and productivity. At the same time, though, that there is embrace of the technology among our students, parents, and teachers, we want to acknowledge the challenges. The lack of connectivity, no device, or access to only one device by many children in the same household, the lack of online etiquette on the part of some students and some teachers and some parents. We acknowledge as well the challenges of safety and security in some homes in which the parents or adult has to go to work and leave the children by themselves. We've heard about the high electricity bills, how parents have to leave their phones while they go to work so that their children can have online access. We've heard the many complaints as well of how quickly the food in the fridge finishes. And that happens when you have children at home for so many hours in the day. And I want to say to all Jamaicans, we get all of that. We're not oblivious to the challenges that the pandemic has brought on all, especially our children, who've been away from the physical school environment since March 2020. We are aware that our students being in the physical classroom environment is important. Being in a school environment helps our children to develop friendships and social skills. It is also a place of safety. We know as well that schools help to develop interests for extracurriculars, the football, the chess, the math and science clubs, dance, and so on. These important skills start to accumulate very early in life. Physical school is an essential part of one's life. It is not only a place where children get formal education, but a place they will grow and develop personally and professionally in the later years and become good humans with strong values and beliefs. I want to thank the staff at the ministry, our regional heads, our teachers, principals, and students who really stepped up to the plate and took on the teaching and learning using the various modalities. And so as we contemplate the phased rollout of face-to-face, and I want to underscore phased, we want to remind you of the steps taken to get to this point. Since starting at the ministry on September 14, 2020, we formed the e-COVID task force that has a wide cross-section of stakeholders. We consult with the Ministry of Health and Wellness to get the relevant data on a consistent basis. We partnered with Mona Geoinformatics to help us with the data and the building out of the various risk factors that impact our schools. We presented at the COVID Subcommittee of Cabinet. We've updated Parliament about the opening of schools and the three approaches that the ministry deployed, the tablet programs and all the elements of back to school. We presented to Cabinet, and we continue to do additional consultation and data gathering to inform subsequent decisions. The reason for laying out all these steps is that there was a coming together of stakeholders to get to this point that we believe parents, students, and all of Jamaica can accept. And so in terms of the face-to-face, we intend to allow for the phased resumption of face-to-face classes in some schools for the academic year 2020-2021. The phased resumption will be done in accordance with Order 14 of the Disaster Risk Management Act. Based on the proposal, the current approaches, which is the online, the audiovisual, and the learning kit, will continue to be available for all schools. For those schools not yet able to return to face-to-face teaching and learning, the ministry will be better able to intervene in a more deliberate way and channel resources to them so that in time they will be able to reopen for face-to-face engagement. Focus will be placed on phasing the reopening of schools for face-to-face teaching and learning based on there being active or not active COVID cases in the first instance, the total risk profile of the school and the community, and the approval from Ministry of Health and Wellness in terms of their physical inspections. As you well know, COVID-19 presents a fluid situation with circumstances likely to change at a moment's notice. Decisions related to the management of COVID-19 must be predicated on an objective test using data in collaboration with the Ministry of Health and Wellness, our teachers and principals on the ground, and our parents and our stakeholders. The ministry acknowledges that the reopening of schools for face-to-face engagement, especially in the case of high schools, presents the challenge of navigating the commute to and from school. The ministry also acknowledges that potential exposure to COVID-19, particularly within a context of community spread, is a hazard that cannot be avoided entirely as we pursue our normal activities. This reinforces the imperative of responsible action on the part of everyone. So I just want to take a few minutes to just walk you through the approach. And on the screen any moment now, you should see a spreadsheet with quite a bit of data. The second column lists all the schools we have in Jamaica. The next column would list the parish, then you have the community. In the purple would be the first column is the vulnerability score for the community, and that's data that we would have used from the Ministry of Health and Wellness, and that would be mapped into the vulnerability case. In the next kind of orange or pink column, peach, we keep track of the data coming out of the Ministry of Health and Wellness with regards to the active COVID cases. And if you move over to the green columns, you will see the total enrollment in schools, the capacity of schools, meaning when schools were built, how many students was the school built to hold versus the current enrollment. So it gives us an occupancy score, if you will. We looked at as well as internet availability in schools, whether or not they have it. We looked at the reliability of internet, and then we mapped that into a score. Additionally, we looked at the water situation in schools because that's extremely important. So we were able to tell if the school has piped water, and if they do, are they subject to lock-off? Do they have tank? Do they have storage? And then all of that information was mapped into a composite. And then schools had to have the Ministry of Health inspections, so we ensure that that variable went in there first. Additionally, we looked at the distance traveled to school, and we do have data within the ministry that helps us to determine how many communities the students transit through to get to their school. That was also mapped into the risk score. And at the end of all of this data, we got the school composite, and we got a total risk kind of score for each school. So the data that we have tells us that there are 73 schools that have been assessed as being low risk based on the many variables. But in these 73 schools, there are 58,542 students, plus teachers, plus parents who would have to wake up and travel to school every morning. That's a lot of persons. And so, to be extra cautious, we will be starting with a subset of that. So we'll be doing an e-COVID face-to-face pilot of approximately 20% of the 73 schools, or some 17 schools in 9 parishes. And those would be 12 at the primary level and 5 at the secondary level. And the 9 parishes are Clarendon, Manchester, Portland, St. Anne, St. Elizabeth, St. James, Westmoreland, St. Thomas, and Trelawney. We will have the pilot for 2 weeks, starting on November 9 to the 20th. During the first few days, the ministry will be working with the schools and parents to ensure that the parents and students have the necessary information to prepare for the face-to-face opening come November 9th. During that time, November 9 to 20, we will be assessing to determine how well this is working, whether schools are abiding by the protocols, and whether or not there are other emerging issues that we will need to take into consideration to inform future decisions. We encourage the principals of these schools that will be open to continue to exercise a duty of care for teachers and students, as the selection is made for those who will do face-to-face lessons. Principals are being reminded that teacher support can be provided to ensure that all face-to-face classes are covered, as well as those who will have to work remotely. We know that there may be students who have underlying conditions and cannot do the face-to-face for the schools that will go back to face-to-face, and we have to accommodate those students as well using the other modalities. In terms of the protocols, students coming to school for the face-to-face must wear a mask, and we're asking principals and teachers not to deny access to students who show up in masks that do not match the school's uniform. The important thing is that students show up in masks, and if a student do not show up in a mask, one should be provided. For parents, the simpler the mask, the better. Understanding the financial stresses many of you may be under, cooperation is key to the success of this approach. I must emphasize the importance of the adherence to the COVID-19 protocols, such as temperature checks and logs, hand washing stations, physical distancing markers, sanitizers at strategic positions, isolation areas with the necessary facilities, among others. And we're saying to schools doing the face-to-face that the blended approach can be utilized as is necessary for these schools in the e-COVID face-to-face. So in summary, ladies and gentlemen, the education sector will not conquer COVID without cooperation. All of us are being called on to help to do what we can by embracing this pace of change and recognizing that we can rebuild and think in new ways for the future. We can provide all our children with a comprehensive set of skills they will need to navigate the world. Thank you.
Good job, Naomi. I think what you could take away from Minister Williams' presentation is that the Ministry of Education put in a lot of effort in having empirical, evidence-based approach towards determining which schools should be reopened. I know we're going to get a lot of appeals. It should be my school, it should be my school. I'm asking our principals and parents to understand that we cannot open all the schools all at once, and that we're going to do a pilot project based upon the scientific data presented, and that pilot project is necessary so that we can pick up whether or not within the model that we created we have left out any variables which we did not properly consider. And once we see it in operation and we are able to study it properly, then we can better analyze the risk of a full reopening. So I'm asking parents to be patient and bear with us. And those who are selected to go back to school, it is important that they recognize that they must exhibit a high level of compliance with the measures. I know you might very well have parents who see and know that their children are ill and still take them to school. These are the kinds of behaviors which will make it bad for everyone else. Because if the pilot goes wrong, there's no way that we could continue to reopen schools. So everyone has this responsibility, this personal responsibility to ensure that as we put in place measures to facilitate normalcy, that we behave in the new normal way that will keep us all safe. I now invite Minister Mackenzie to give his update. Minister Mackenzie.
Thank you, Naomi. Prime Minister, colleagues, ladies and gentlemen, good evening. Minister Tufton in his comments gave an update on the situation within our infirmaries. I know that the concerns are real about the state of the infirmaries across the country, including the Denham Town and Vineyard Town Golden Age Home, since the recent cases were discovered. I want to emphasize that the testing protocols have been working within our infirmaries, and it was because of the continuation of that process why we were able to discover at an early stage the incidents that have occurred in the infirmaries. We have been able to keep our infirmaries COVID-free for the last 7 months. And before that, it was only 4 infirmaries that recorded any case of COVID. And the total number up to the end of September was 5 overall cases. Since then, the numbers have gone up, and the work of the Ministry of Local Government, working closely with the Ministry of Health and Wellness, we have been able to put some strong level of control. Since then, we have increased the surveillance capacities of all our infirmaries. We are still enforcing the no new admission and still maintaining a strict protocol as it relates to no visits. I want to make the point that we are getting a lot of requests, Prime Minister and Dr. Tufton, from many relatives as it relates to visits to their loved ones in the infirmary. We are presently devising a program that we are going to be sharing with the Ministry of Health shortly that will put us in a position to create some avenue for visits that would not take individuals into the infirmary itself, but something like a drive-through or something that we are presently working on. And once we have concluded those arrangements, we will share it with the Ministry of Health and try to make it possible. But in the meantime, the staff within the infirmaries have been going through their paces and have been creating an environment to make the residents feel comfortable. So there are recreational activities that are taking place. We are putting in the necessary infrastructure, providing the resources to ensure that we continue to provide and make the infirmaries conducive. I want to assure the country that the government is on top of our infirmaries. Despite the slips that occurred at the Vineyard Town facility, we must commend the staff of the infirmary for the work that they have been doing to keep our infirmaries COVID-free. We are going to be putting in, working closely with the Ministry of Health, regular testing and inspection of the infirmary, and we have undertaken a new sanitization program of all the facilities, and we are improving the personal protective gears of workers and to ensure that all the protocols are observed. So, Prime Minister, in short summary, we are continuing the work to protect the most vulnerable in our population. Before I take my seat, Prime Minister, just one update. We did earlier in the piece gave permission for the reopening of cinemas, theaters. And since then, because of the change in the curfews, there have been some challenges with the operation of the cinemas. Well, we have agreed, and the protocol will now include, come the 1st of November, drive-in cinemas, which is presently in operation, but because of the rains, the kick date start was pushed back. Now we are going to be engaging the operators of the drive-in cinemas to ensure that the strict protocols surrounding how many persons can be in a motor vehicle will be worked out, but to give notice that we have sanctioned and will be working for the establishment of drive-in facilities for a certain level of entertainment. The ban on nightclubs are still in place. There is no permits that are issued for any parties. Those bans are still in place, and I want to ask the public to understand that the security forces will be enforcing. And we are presently working to make adjustments to the Disaster Risk Management Act to make breaking the offense one that persons will regret that they have done so. I urge the public for their support as we continue to grapple with this outbreak that is affecting the country. And I must commend again the staff of the Ministry of Health, the Permanent Secretary ZR1, and the Acting CEO to express our gratitude for the work that we have been doing with the Ministry of Health and the Ministry of Local Government. Thank you, Prime Minister.
Thank you, Naomi. I think we have presented a comprehensive report, so I'm not foreseeing many questions, but for the few questions that there may be.
Thank you so much, Prime Minister. Ahead of the press conference, we did ensure that all members of the media were online and were audible enough for us to have a smooth transmission. And so I see and recognize Janet Silvera from Western Jamaica, the Gleaner Company, as your first person who will ask a question. Janet, over to you.
Yeah, I know. Just a minute. My question is to the, good evening, my question is to the Minister of Education. Would she be able to give us the names of the schools that have been selected for this pilot project?
Thank you for that question. We wouldn't be able to give you the names of those schools today. For one, we're still in consultation with the principals of those schools to ensure that the information goes out in a timely manner to the parents so parents can prepare for that. When we've completed that, I think at that time we'll be able to identify the schools. But at the same time, we don't want persons to be targeting those schools because they are a part of the pilot. Those schools are a part of the pilot and other schools are not. We recognize that there's a lot of anxiety about wanting children to go back to schools, but we're asking for the cooperation of all Jamaicans, especially those who have children that are not a part of this initial pilot. Again, as you heard the Prime Minister say, and I repeated, we are looking for the experience over the 2 weeks in November in which these schools will be operating to see how it's working and to see if there's anything that we missed along the way. So in due course, we will say what the schools are, but again, we just want to go through that entire process of making sure that our principals, our parents, and the students themselves are prepared for that first day.
Thank you so much, Minister. We ask those on the Zoom platform from the media if you would also just use the raise hand emoji so I'd be able to ensure that you get your question across to the Prime Minister, and the Minister is here. Prime Minister, a question from social media. Of course, we're on all platforms to include, of course, Zoom that we're on with the media, Facebook, Instagram, Twitter. Question from Twitter, Minister Mackenzie, areas to swim, are those still in place, and other prohibition notices regarding churches and funerals?
The question of beaches and rivers. Remember, we had closed some 36 beaches and 17 rivers. Those orders still remain, but there are some beaches and rivers that are presently operating. I'm glad that the viewer have sent in this question. We have noticed within the last 3 weeks or so that some of those beaches that were operating within the guidelines that was set out by the Ministry of Health and the Ministry of Local Government are violating those protocols. And we are reviewing what is presently taking place at those that are operating outside of the guidelines. The next question was in regards to funerals.
Funerals and weddings, sir.
The Prime Minister did announce that the protocols surrounding funerals are still intact. There is to be no funeral service within a church. Procession will be limited from the place of where the body is being taken to the cemetery. Only 15 persons will be allowed to the burial site. So the ban still remains in place for funeral services. Burials are restricted to 15. The next question was weddings. Weddings are 50 persons based on the limitation, the size of the location. So none of those protocols that was announced have been changed so far.
Thank you so much, Minister. A follow-up, I'm not seeing the name, but I think this may be someone from the religious community regarding, they're thinking ahead, sir, regarding watch night services.
No, well, let me assure you that the government is also thinking ahead. And, one of the reasons why we decided to keep the measures as controlled as they have been is so that for the Christmas period that we can have a loosening, let me take back that word, that we can have a controlled relaxation of the measures. So at least for that period. So it all depends, of course, on what the numbers are saying now. So if we keep the measures faithfully in compliance, it is likely that we should be able to have a controlled relaxation of the measures during the Christmas period. And even then, we would ask our citizens to exercise even greater personal responsibility in how they move around. So yes, we're considering how we can accommodate that, but we still have some time before we make some definitive announcements.
Thank you, sir. I recognize Ms. Vanessa Silveira from the JIS. Vanessa?
Hi, good evening. My question is to Minister Mackenzie. What kind of mental health support is being provided to staff and residents at the Golden Age home, especially following the death that was recorded? Mental health support.
Thank you for the question. We've been working closely with the Ministry of Health and Wellness on that, and there is a program for mental health counseling and assistance, not just at the Vineyard Town Golden Age home, but right across the parishes. We have also sought the assistance of guidance counselors and supporting staff to give moral support to the Vineyard Town Golden Age home, and we are going to be replicating that right across the country, because we know that these are difficult times and there is that sense of fear and concern, and we want to give the assurance to the staff and the country that the government is proactive and we are working to ensure that they are comfortable in executing their responsibilities.
Thank you, Minister Mackenzie. I know it's 7:35 and we do have a 9 o'clock island-wide curfew that will start. Prime Minister, ahead of getting to Althea Saunders from The Observer, another one, I believe this is for the Minister of Education, concerning laptop computers or tablets that have been given to schools and students. The writer says some schools are insisting that they are for rental. What is the position of the ministry?
No, absolutely not. The government's tablet programs, as you're well aware, is currently very targeted towards the PATH students in our primary schools in grades 4, 5, and 6. In the first instance, the 40,000 tablets that are being distributed now, it's for those students, and based on the numbers we have, we believe that each PATH student in those grades, 4, 5, and 6, will be able to get a tablet. It is for the student. The parents would come in and sign up the proper documentation for it. We have additional procurement that are underway right now, in which we will be procuring laptops also for our PATH students in grades 10 to 13, some of our PATH students in grades 10 to 13 in our high schools. We also, in short order, will be announcing a program that will help non-PATH needy families in terms of being able to get a voucher for a value of $20,000 towards the purchase of a tablet or laptop. Tomorrow, I will be at the Jamaica Stock Exchange along with many of our major sponsors, launching the One Laptop or Tablet Per Child initiative, in which we have made a broad appeal to Jamaicans, to the business sector in Jamaica, to individuals, to our diaspora, to our international partners, to come on board with us and help our children get the devices in their hands so that they can become a part of the digital journey that this country must take. All the donations, we will ensure that they go to the school of the donor's choice, if that is indicated. We will keep track of the students who receive the tablets so that there's no duplication along the way. And we've emphasized this at the ministry, at the unit called the National Education Trust that's responsible for ensuring that these donations are received and in a very transparent way. So our plan as a government is to ensure that all our students in our schools, primarily in our public schools, are able to have these devices so that they can be exposed to the many educational websites that are available so that they can become digitally literate and even move from there to become digitally fluent in the use of technology. So no, if there's a school that's renting any of these devices or selling them to students, we need to know about it because that's not permitted. These tablets are for the use of our children in school, in classes, when they go back to face-to-face and at home. We want them to have it and to be able to get access to all that's available using that device. Thank you.
Thank you, Minister. And Prime Minister, a final question then comes from Althea Saunders of the Jamaica Observer. Althea.
Hi, good evening. I just wanted to know, do we know the total number of students who are enrolled at the 17 schools that will be involved in the pilot?
Certainly. I mean, I think that's about 5,000 students. It's 5,875 students for the 17 schools that will be involved in the pilot. How many schools have we identified totally that could go back? So there are 73 schools which fit the criteria which we have set as being relatively low risk. I wouldn't say safe, but relatively low risk. Those schools have approximately 58,000 students, and of course the teachers and parents who would have to be moving as a result of that. And that would be a large number, and therefore instead of taking a risk like that, we've decided to test this model of low risk that we have created, because we don't want to lose any variables or overlook any variables. And therefore, we're going to test it in the real world with 17 schools and see what factors impact on the spread of the disease within the reopening of school. I want to thank you for your attention and patience with us as we go through some of these routine and oftentimes weighty issues. But it is important that we keep the lines of communication so that the entire Jamaican public understands what it is that the government is doing. Thank you very much, and enjoy the rest of your night.
Thank you so much, Mr. Prime Minister. Thank you so much to the ministers here with you too, the Honourable Dr. Horace Chang, the Deputy Prime Minister and Minister of National Security, Dr. the Honourable Christopher Tufton, Minister of Health and Wellness.
One could say we're moving in the right direction and clamping down on such behavior.
And the police are reporting that 3 men who were arrested in connection with the murder of a 32-year-old businessman in St. Thomas on Tuesday, October 13, have now been charged with murder. They're 39-year-old Roger Squire, otherwise called Bye Bye, of Pipe Road, license, St. Thomas, and of a New Jersey, United States address. 25-year-old Kevin McLean, otherwise called Stammer, of First Street, Kingston 11, and Jabir Johnson, a footballer, otherwise called Baller, of Adelaide Street in Kingston 16. So the news came that the police had this murder had taken place.
Yes.
There was an intercept by the police. One of the suspects was killed. In that immediate intercept, reinforcements came in. Another of the suspects was killed. And then we're hearing that these 3 people were charged for murder today.
It was all very swift, thankfully. Well, when we return, the business segment, so stay with us.
Lloyd's hard work plus flow equals a farm full of progress. That's what happened when Flow connected Lloyd's farm to the internet for the very first time. Now there's more work and progress for his family and smiles all around. Every day we are connecting more communities from Negril to Morant Point, and that makes Flow Jamaica's largest network.
You can open a Sagicor Bank savings account from anywhere. You could be here completing the application, or here uploading your information, or out here receiving your account details in just 48 hours. Go online and open your Sagicor Bank savings account today.
Well, time to check out the Mark Minute, the Business Minute, and then the Business Live at Mark Croskery.